This is day number 16. I'm Alan. I'm at Pulmonary Wellness, and I'm going to wish you a very good day. Now, I'm going to turn it over to Noah with the question of the day.
Perfect.
Okay. I had a good day today, and I didn't expect a good day, but apparently I do better on my hard days, as far as the PVCs are concerned and things like that. I do better on my hard days.
So you're saying you have less PVCs during the tougher workout?
Much less.
Okay, so that's not unusual, because the PVCs, or premature ventricular contractions, those occur when the heart is resting. So when you're doing the lighter workout, there's more time in between beats for an irritable, we call it an irritable focus,
Yes.
to jump in and contract prematurely. When you're doing the harder workout and your heart rate is actually faster, there's no time. Not only just time, but the chemistry is such that the PVC cannot jump in. So it actually makes sense.
Wonderful. That clarified it very nicely.
All right, have a good day.
You too.
Alrighty, so today's question of the day comes from Mary Lynn Young, and the question is, could you explain what an ejection fraction is? My pulmonologist son-in-law asked what it was. It's 66%. I learned, but I don't know what it means nor what it would mean to him, given that I was just asking about a lowered in the 30s and 40s beats per minute. I assume you mean your heart rate, even though my pulse ox was 94 to 97%. I think a lot of my problems resolve around anxiety. This program is helping resolve a lot of that too. Excellent. I so want to be as healthy as I can be that I worry too much with every change, and that drop was a change from in the 60s at rest to in the 30s and 40s at rest. Okay, so first and foremost, let's talk about ejection fraction. So we have two phases of the cardiac cycle. Okay, one of them is called systole, which is the heart contracting. The other is called diastole, when the heart is filling. And when we talk about systole and diastole, we're really talking about the ventricles, right? The left ventricle, as I've told you many times before, is the main pumping chamber of the heart. And at the end of diastole, there's a maximum amount of blood in the heart. So we have this amount of blood, and this is called LVEDV, which means left ventricular end diastolic volume, right? So imagine it like this. Here's the left ventricle at the end of filling. So this is just before the left ventricle contracts. All the valves are closed, right? We have the LVEDV, which is the left ventricular end diastolic volume. Now, when systole occurs, in other words, when the left ventricle begins to contract, right? The pressure in the left ventricle exceeds pressure in the aorta, and that causes the aortic valve to open up, and blood is ejected from the left ventricle, okay? That blood is known as the stroke volume, okay? Your ejection fraction is your stroke volume divided by your left ventricular end diastolic volume. So in other words, of all of the blood that was in here at the end of filling, of all of the blood that was in the left ventricle at the end of diastole, at the end of filling, what percentage of that blood is ejected as the stroke volume? Your value is 66%, which may not sound that good, but you will be happy to know that normal is 55 to 75%. So you are right in the middle of normal. Now, my question comes in the form of, why would your heart rate be in the 30s and 40s? Okay, that is an extremely low heart rate. Normal heart rate is 60 to 100 beats per minute. And there are certain protections, like your heart has multiple pacemakers. So you have the initial pacemaker of the heart, which is the SA node, which typically beats at 60 to 100 beats per minute. However, if the SA node does not fire, or something goes wrong with the SA node, the AV node can also fire. and the AV node can fire at 40 to 60 beats per minute, okay? And if that doesn't occur, then the ventricles can fire and depolarize at 20 to 40 beats per minute. So my question to you is, your ejection fraction is perfectly fine. You say that your heart rate is normally in the, your heart rate is normally, in the 60s at rest, which is normal, okay? But my question is, why would it drop down into the 30s and 40s? So first and foremost, I want to know, how are you getting that number? Where are you getting that number from? Is it off of your pulse oximeter, okay? And that would make me want to say, of course, we have to make sure that it's an accurate number. The next thing I would want to know is, are you taking any medications that could potentially lower your heart rate like that? And the most common culprit of that is what's known as a beta blocker, okay? And those usually end in LOL. It doesn't mean you're laughing out loud, but it's like atenolol, labetalol. There are others, okay? But that would explain it. But even if you're on a beta blocker, 30s, 40s is still pretty low and could potentially compromise your cardiac output. So I would want that information transmitted to either your internist or your cardiologist immediately. And if you are on medications, then you need to make some kind of, they may want you to make some kind of medication adjustment, because your heart rate does certainly not need to be in the 30s and 40s, okay? So those are the questions. So no problem with EF, okay? Question, why is your heart rate so low? The other question I would have is, sometimes in patients who are taking digoxin or lanoxin, and they take that typically for atrial fibrillation to help the heart pump better, sometimes if their digoxin levels are too high, that can also cause the heart rate to be very, very low. So my questions would be, are you on a beta blocker? If you are on a beta blocker, or even if you're not on a beta blocker, I would certainly want to let your internist or cardiologist know that your heart rate is in the 30s and 40s, and see if they want to do a 12-lead EKG. If you're on a beta blocker, while that certainly explains it, if that's the trend and that's how it always is, I would want to let them know that as well, to see if they want to make an adjustment in the dose. Third, if you do have atrial fibrillation and you are on digoxin, then that is something that I would also need to convey, or you would also need to convey to your internist and or cardiologist, because it's possible that your dig levels are off. Finally, the question is, how do you feel? Okay, how do you feel? So at a heart rate of 30s, 40s, signs that you're having a problem would probably be in the form of lightheadedness, dizziness, shortness of breath that is disproportionate to the situation. So these are the things that I'd want to find out. And even though this isn't till tomorrow, I'm going to contact you now and just find that out, so that we don't go 24 hours before we get an answer. Okay, bye-bye. Have a great day, everybody, and have a great day. Bye.